人是 something that you do， 而不是 something that you are。
每次我跟同学说我在做飞秒纳米分辨光学实验，他们都问我会穿越吗？
聚会的时候，每次我说我要早点回去照看我的小鼠，他们都以为小鼠是个师妹。
写代码不枯燥啊！我今年就用自己写的代码给猫主子做了一个自动洗毛机。
跟不同专业的同学们交流，总是能得到很多新鲜东西。纳什均衡、囚徒困境、时空曲率、霍桑效应。
吃货搞学术，当然有一半是为了吃了。动物外边有一家串店，拿着你发表过的论文去呢，可以打折，影响因子越高，折扣越高。所以说，努力发 paper， 为了免单而战斗。
欢迎加入沙鹰社，有机会在珠峰上被求婚哦。
他现在跟他妈妈打电话都会忍不住说 unbelievable PicK C 位，
跟我们视频他都听不懂了。
师兄，我还是睡不着，要不你给我念书吧。
好的。Abandon, abash, abate, abbreviate, abdicate, recall。
在北大刷夜是什么样的体验？
囤精神食粮的地方才是真正的深夜食堂。
我们是微纳米加工实验室的超进间，所以在这里刷夜绝对没有雾霾。
我们刷的不是夜，是星星。
跟随大师去英国参观顶尖博物馆，亦或是去美西跟随学术大咖学习，和各国小伙伴在模拟联合国大会上纵论国际局势，亦或前往瑞士、越南、卡塔尔比赛支教考察。北大每年都有300多个国际交流项目，让你与世界对话。还有来自各领域的大佬经常空降校园，与你零距离面对面。
北大每年开设5000多门本科课程，拓扑学、疾病侦探学、舌尖上的植物学，翻一遍课名列表都觉得涨了不少知识点。
除了高考录取的专业以外，北大其实还有2次选择的机会呢。你可以选双学位啊、辅修啊，还可以选很多有特色的本科生项目。
对 AI 感兴趣的话，可以加入我们图灵班哦。这是由图灵奖获得者 John 亲自设计的全新课程体系，和科研一线学者一起挑战科研极限，想想就有点小激动。
我的梦想是成为一名外交官。大一结束的时候，我选择了 IO and IPP 项目。今年暑假，我和来自世界各地的小伙伴在联合国进行了4周的实习，共同探讨世界能源问题。
北京大学医学部欢迎你哦！撸串的时候，师兄会用身上的鸡骨头帮你复习外科常见骨折类型。
我现在所在的位置是法学院的模拟法庭，今天来
欢迎报考新闻传播学院。
一桩劳动合同纠纷案。
欢迎报考北大新科，和我们一起在计算机编程界最高国际赛事上体验最后30秒绝杀摘金。
欢迎报考考古文博学院，我们不仅挖坑，更用前沿科技摆渡今天和过去。
当一个北大人，你应该会打卡很多内容，比如看过博雅塔亮灯，走过未名湖的四季，在古建筑里上过课，还有带上帐篷、棋牌和小伙伴排队一起领10佳歌手赛的票。
待久了就会发现，北大不仅是个大学，还是个生态保护区。这里有1000多种动植物跟我们生活在一起，很多都濒临灭绝。这是飞来的新客人，黑天鹅。
你会对这个园子心生敬畏。北大原本就是皇家园林的一部分，园子里一块不起眼的小石雕，可能都是文物。
一个北大人，不管你承不承认，你都会浸染上这座园子理想主义的色彩。
它教会你仰望星空，更教会你脚踏实地，不务空名。
一个北大人除了关心自己，更会关心这个世界。
当一个北大人是一种怎样的体验？你应该自己来体验。
Welcome to PKU, welcome to our online information session, and I'm your host today. My name is Angela. So today we're going to bring you information about PKU medicine, and we have two speakers to precede the introduction. Please allow me to introduce them. They are Assistant Professor, Research Associate Professor Yin Zijin. Welcome.
Thank you, Angela. Hello everyone, I am Yin Zijin from Department of Global Health, School of Public Health, Peking University. I'm very glad to be here and have all of you on board.
Welcome, thank you. And our another representative is Program Officer of International Cooperation of PKU Health Science Center, Wei Gangneng. Welcome.
Hello, I'm Neng Weigang from the Office of International Cooperation of Peking University Health Science Center. I enjoy working with international students from different backgrounds.
Well, I think that you have lots of stories to tell us, right?
Yeah, I like to share.
Yeah, thank you. So we're very happy to have you here today, and also I think that right now people are paying more and more attention to our healthcare, especially when the outbreak of COVID-19 has happened, and I think that that might be the reason why people started to apply to study at PKU medicine, because we're starting to focus on this question and some global issues, I think. So now the floor is yours. Shall we start?
Yeah, thank you, Angela. First, I want to give a brief introduction to Peking University Health Science Center.
Okay.
So let's see a brief history of the center. So Peking University Health Science Center was founded in 1912 as the first government-funded Western medicine university in China. And in 1946, it became a school of Peking University, the medical school of Peking University. And in 1952, we were separated in the higher education reform of New China as Beijing Medical College. And in 1985, we were upgraded into a university again. It's called Beijing Medical University. And in 2000, we were merged into Peking University again and became Peking University Health Science Center as it is now.
Till now. So you have quite a long history, I see.
Yeah, 109 years.
Wow. Okay, so what can we learn here?
So we are not just a medical school. We have a lot of disciplines concerning medicine. For example, the basic medical sciences, pharmaceutical sciences, and public health. Also, the main discipline is clinical medicine.
Okay.
Yeah.
So I see that they're not only one-sided disciplines, but you're multidisciplinary, and they are health related, right?
Yeah, we are very strong in almost every aspects of the health sciences.
Okay.
Yeah. So that's why we are not called medical school, it's health science center.
Oh,
right?
yeah, I got it.
So we also have a lot of teaching resources. That's our hospitals. We have 10 affiliated hospitals and 15 teaching hospitals. So some of the hospitals are among the nation's top hospitals.
Wow, so I see some of them and you're working with them, right? So you have a close cooperation. And I think that if you have so many places to cooperate with, so it provides all necessary conditions for students to have clinical training up to the highest standards of medical education.
There are not, we have not only the comprehensive hospital, which, contains a lot of departments, we also have the special hospital, for example, the dental hospital, the mental hospital, and a lot of others. So, students who are interested in studying, one of the subjects they can come to our.
There are also some of them which are not in Beijing but all over China, right?
Yeah. For example, the Shenzhen hospital is located in Shenzhen, China. Yeah, it's also a very large hospital. Yeah. Okay, today I want to promote especially executive master public health program. Yeah, this program is designed in the circumstances of COVID-19. Yeah, and this program aims at the students who want to have a master degree in public health and who want to have a leading vision concerning the global health policy and management. Not only in China and across the globe. So next, I will invite my colleague Ms. Jin to introduce this program for you.
Okay, welcome.
Thank you very much. I'm very honored to be here to make a brief introduction of EMPH program. First of all, the program is offered by the School of Public Health, Peking University. It is the leading public health school in China, which is established in 1931. And we have 10 departments and 2 institutes with more than 180 faculty and staff members.
So have you been studying also at PKU?
Yes.
So what was your major?
Yeah, I'm from the Department of Global Health.
Oh, global health. Yeah. Well, I think that this might be also a common word because global, we're also in the era of globalization. But what does it exactly mean? What does it include? Like global, it's like a huge range of things can be included.
Yeah, many people may think that global health study the public health at the global level, but actually part of it, global health can be viewed based on the discipline of public health, but it focuses on population all around the world, rather than the concept of particular nations or regions. For example, as you mentioned, the COVID-19 pandemic, the faculties in our department have been engaged in multi-level research from the different perspective with their different research background. For example, the professors with a background of epidemic knowledge may focus on the global trends in the pandemic and the influence factors and do some prediction of the pandemic. And the professors with health systems may focus on the different health systems in different countries. Auto analysis how the different health systems can impact the preparedness and the response of pandemic. And the professors with background of global health governance and diplomacy may focus on the international health regulations and some particular issues. For example, the COVID-19 vaccines, how to do the research and development of the vaccines and how to achieve the equity distribution of the COVID-19 vaccines globally. So we have multi-level and multi-dimensional research in our department, but also in other departments, we also have different branches of the...
I understood. So for example, if we're talking about COVID-19, actually it has lots of things which are separated. It depends, like you can find your field and make deeper research.
Yeah.
Okay, I got it.
Okay. And the program is committed to enrolling international students from all over the world. And for the graduate education, our school have 3 components of degree programs, including the master degree, the PhD and the DRPH degree, and the MPH degree. And with the development of global health, we definitely consider that there will be a pressing need to train students to be prepared with the competency of research and practice, especially in the field of global public health issues. So that's why we also think that we should not only train the students in domestic, but also students from all over the world. So that is why the EMPH program came out.
Oh, so I see that these ones, which we see right now on the screen, these were more like Chinese taught and like for Chinese students. And now you have a special program, not now, but already like for couple of years, right?
Yes.
Yeah, so this is a EMPH.
Yeah, EMPH courses are open to the world and welcome the international students, and all the courses are in English.
Okay.
So the mission of EMPH program is to we provide comprehensive training to train students to be prepared with the competency of research and the practice in the field of global public health issues through education, research, policy advocacy, as well as the international network built established. We expect students who complete the program will have a sense of responsibility to engage in the public health and global health, and to master the theories and methods of public health, and to recognize and discover the existing and emerging public health issues and propose corresponding strategies through research and practice. And also we want students to have core competencies in academic research and practice field.
So I see that you have all resources like to help students towards become a qualified medical or healthcare professional, right?
Yes.
And also thinking about not only about education but also about training.
Yes, definitely. So it is a 2-year program, including 4 semesters. We have 3 stages of training: the full-time learning, and the professional practice and the dissertation. Generally, the first year is for the full-time learning at Peking University, and the second year is for professional practice at their students' home country or other developing countries. And the dissertation goes through the home period of schooling.
Okay. And talking about full-time learning, so you have just mentioned that you have a special online course, and you have also one which is here in Beijing, right? So what is the difference? Is it a kind of a personalized?
I will talk it a little.
Oh, okay.
The first stage is a full-time learning. So students can choose, take many compulsory and selective courses. Unfortunately, due to the COVID-19, students have to stay online at their home country. But we, to assure the quality of training, our School of Public Health has developed a unique course platform for EMPH students. We have about a number of courses which are designed and recorded by the professors from different departments of our school. So there are many differences between the new one and
what I'm curious about.
So the courses are new and designed based on the needs of all the EMPH students. As you know, most of the students came from the Africa countries and other low middle income countries. So we did the needs assessment and the baseline survey targeted to all the students and assess their needs for education and research. Then we design the courses and make it a very particular training package specifically for the students.
Wow, well that makes sense, because I thought that maybe that's the same package which was for Chinese students, but actually you're thinking a little bit further, because there might be different needs in different countries, and also about talking about some diseases or illnesses, so you need to be quite sure what problems they are facing. So this is an adapted program. Like localized.
Yes, for example, the course on epidemic knowledge may focus on the diseases which are prevalent in their home countries, and we talk more about the disease prevention and control. And the course on the health systems may more focus on the systems. We will do some comparative studies between systems in China and Africa countries, and we also offer the course of International Health Project Management, which trains students to let them know how to do the health projects and the field work in other countries, what they should where they will be more prepared for the next stage, the professional practice.
Oh, okay.
Yeah, so they will take the professional practice after they complete all their courses. Generally starts at the 3rd semester.
So what do they usually do at this time?
They can choose by themselves the health-related international health organizations and hospitals, or medical institutions, universities, or national health administrations to do some field work, internship, or professional practicing. We also have some overseas research and teaching centers of Peking University, which are based on Geneva, Malawi, Myanmar, and Georgia.
Wow.
Yeah, in this basis, we have many international health projects. So Peking University Health Science Center have very good relationship with this basis. For example, the First Lady of Malawi is the honorary professor of Peking University, and in 2019, she came to our campus to give speeches and talked about the further communication and collaboration in health research and health education. So there are many opportunities for our EMPH students to do the health projects and the field work in our overseas research teaching center.
Well, as far as I can see, so you have many projects and also talks which cover a range of topics from medical innovations, global health and medicine, or maybe also you have some policy and healthcare debates, right?
Yes. Yeah, the 3rd stage is
the hardest one for us.
Yeah, but it's required for a degree. Students have to select a research topic and write literature review, but all of them are guided by our supervisors. And they will take the thesis proposal. Generally starts at the 2nd semester, and at the 1st semester, they have to take the oral defense thesis with the complementation of dissertation writing. But I think they will get well treated after all of the training to know how to write literature review and how to do academic research and write a dissertation.
Yeah, when I see this word, it's like, this is the hardest thing. But I don't know, like in medicine, maybe also when you're doing research, this is the most important. And then writing, maybe not the hardest one.
Yes, of course. So till now, we have 2 rounds of enrollments since 2020. We annually enroll about 15 students with a total of 30 international students. Even though we cannot meet face-to-face on the campus, but we are still very excited to have all the students on board, not only during the admission interview, but also during the online orientation in both of the years. You know, the distance cannot stop our communication, but provides the convenience for our connection. We use the WeChat, emails, Zoom to not only during the course teaching, but also during the daily communication and discussion.
Yeah, because right now online platform and internet gives us opportunities, although we're kind of separated, but actually we're linked together, so that's not a problem.
Yeah, students are very familiar and use the WeChat very well. We also make the Chinese name for them and make the Chinese name for the account of the WeChat.
Yeah, that's a good question. Why your program? I see that. I see the question.
I think all the students will have a very fantastic experience in our EMPH program because all the professors and the supervisors are very experienced in research, education, and the practice in the field of global public health issues. And the students will have a vast global alumni network, which have been increasingly become a backbone for their engagement in global public health issues, as well as they can develop a stable partnership as part of the alumni network. Then I believe they will enjoy the learning journey in Peking University School of Public Health for the EMPH program.
But what was your experience? Because you told that you have been studying at PKU as well, so you were a student and now you're teaching. So what was your experience, maybe the hardest thing, and what maybe students during their studies should pay attention to, like from your experience?
From my experience, I think students, first of all, all the courses are online, so the courses are recorded before the courses take. So students need to be more self-disciplined. You to take courses. That is the most important thing. And the second, students, because of all of the communication are online, so they have to use the WeChat, the Zoom link to make the communication and the discussion more efficiently.
And if you have any questions, no worries, we have program officer here, right?
Yes.
Okay, thank you, Ms. Jin, for your detailed introduction. Next, I will talk about, the most important part, how to apply.
How to apply, yeah.
I think after, listening to
it's
the
right about time,
yeah. It's time for you to understand some, procedural things, yeah. So first, the eligibility. So that's some requirements for, applicants. So we do have some requirements for, the concerning age, working experience. It's better for you to have, 2-year working experience in the field of public health. For example, you are, health officer, or you are a doctor or a nurse.
Okay.
Yeah, that will help you to learn better at this program, and some other requirements.
Yes, also age, about English. If you're not a native speaker, so you
have to provide a TOEFL or IELTS.
IELTS, yeah.
So you can apply from January to May each year through the CFC website.
And take a look at the materials which are required. Sometimes just look through and read carefully. This is very important part, because just if you will miss one, then maybe it will be a pity that you will lose a chance. Yeah.
Yes.
And also talking about, I see CSC, that's a scholarship. So if you want to know more about scholarship and other opportunities, you can also take a look at our info session, which was taken with the International Students Office. So we have very detailed information, so you can take a look at that.
Yeah, thank you, Angela. So I want to talk a little bit more about the scholarship. Sure. So the CSC scholarship is, called the Chinese government scholarship. So if you want to apply for this scholarship, you must contact the local embassy in your country. And it's a full scholarship, which covers tuition, accommodation, and insurance, and you will get some living allowances every month. So that will be very good for students from lower income countries. Yeah, and also all the students are welcomed in this program. So this is our contact info. If you are really interested, you can contact us. Yeah.
Feel free to contact us. Yes. And from my point of view, there was one question, like we were talking about studies and about the program, but what about some activities? Like, I think that a student's life, this is when people are about to enjoy life, right? So do you have any kind of activities prepared?
Yeah, I think after school activities in Peking University was very wonderful. So there are a lot of students clubs in Peking University. If you are interested and also have time, you can join one of them. Also, we have activities organized by local organizations. For example, the Foreign Students Association of Beijing City. Yeah, once I have
maybe your favorite. You can share.
Competition with one of my students. She represented us to it's a Chinese calligraphy competition. Yeah, the calligraphy is some kind of art. I don't know much about it, but she got the first prize among all the foreign students. So that really surprised me. Yeah, I think you can find your group here in Peking University and in Beijing.
Yeah, there are some weeks, I don't remember when is it, but when you're already here on campus. So there are some weeks when all of these clubs, they're on the road, on campus, so you can just walk around and see maybe there's something that really attracts you, and if you have time, of course. Yes, but well, that was very fruitful information. And maybe the last question also, do you have a kind of a story maybe, or something that you would like to share with people who are watching us right now?
Yeah, I have been working with foreign students for 6 years. During
lots of stories, I guess.
During these years, have been a lot of things happened, and bad things, good things, and I want to share one a small story. So in 2018, on the New Year's Eve, when I was having dinner with my families, and one of my students called me and said he had some kind of stomachache and was in the hospital. Actually, he was new in China and on this campus, and didn't know much about Chinese hospitals, the procedures, everything. So I rushed to the hospitals and take him to the doctors. He was diagnosed with appendicitis. So a small illness, in our eyes.
But still, people get hurt. It hurts,
But for the students, it's a big thing. So
especially when you're abroad and when it's like a celebration and you're feeling a bit alone and lonely. Yeah,
he really feel helpless and lonely. Has no friends and families around. So I signed the papers for him and sent him to the emergency operation room. Yeah. The operation, was fine in our hospitals. One of the best hospitals. So this, when I was standing, on the corridor of the hospitals, I was seeing all the fireworks, outside, the holiday thing. Yeah. I think the most important thing, more than this celebration, is I was with the student. I think he needed more at that special time. So my telephone is always 7 days, 24 hours on for my students. They can contact me if they have any problems. I think it feels good to help them. Yeah.
And I feel that responsibility that comes from you, and also I think that students who come here to study, they can feel safe. Yeah. And what about you? Do you have anything to say? Maybe why PKU, why your school, and something maybe from your experience? Well, you have told already one story, maybe something else.
First of all, I really want to show the beautiful scenery of Peking University, which is located in Beijing of China, the capital of China. I believe all of you will enjoy not only study in Beijing, but also the very impressive life, happy life in Beijing. Which will impress you with the diverse culture, technology, and education.
Okay, so thank you for the introduction. And what I want to say, so after listening, and I've also have been doing a small research here, so I think that students who are studying here, you will get educated and trained into professionals of medicine and healthcare of tomorrow. So it's time to think about, would you like to become a PKUer? Okay, so thank you for watching, and thanks to our representatives. Thank you very much, and see you at PKU maybe. Thank you. Goodbye.
Thank you. Bye. Please join us.